Greetings, friends. Today we're going to talk about a rather unpleasant but very relevant topic. So the topic is nail fungus. This condition has two synonyms, onychomycosis or nail mycosis. Well, the word mycosis is basically clear. Mycosis is an inflammation associated with fungi. I must honestly admit that what prompted me to address this topic was not only the huge number of requests I received by email about this condition, but also the fact that quite often a large number of scammers, charlatans really, and I could use even stronger words, are advertising all sorts of medications for treating fungal infections in every part of the human body using my name. I receive letters every day asking me whether it's true that I recommend this or that particular medication. Let me say right away that I have absolutely nothing to do with advertising antifungal medications for treating nails. But I have seen so many letters describing the suffering caused by nail fungus that I really do want to talk about it. So let's get started. Nail fungus is a condition that affects the nail plate and the surrounding structures. These include what's called the nail bed, the matrix, and the periungual folds. These are lesions caused by fungi. This disease, just think about it, affects 10 to 12% of, for example, the population of Europe. In some countries it's a bit less, in others a bit more, but on average 10% of the world's population has this problem. At the same time, onychomycosis occurs 1.5 times more often in men than in women. However, men visit the doctor half as often. By the way, the elderly are more frequently affected, while children rarely get this disease. We'll discuss with you later why this happens. There are very clear explanations for this. It should also be noted that toenails are affected 10 times more often than fingernails. We'll also talk more about why this happens. What should you understand? One of the main problems in treating onychomycosis, of course, is that people seek help too late. Unfortunately, and I mean very unfortunately, people doubt the diagnosis and hope it will go away on its own. They try to treat their nails with all sorts of things: iodine, brilliant green, soaking, heating, applying soap, especially household soap. But it doesn't help, and people only come to the doctor when it has already become a very noticeable defect. Well, today we'll talk again about why it's so important to arrive on time. How does it start? Where does it come from? First of all, in order to get infected, you need direct contact with the fungus, with an infected person. That is, direct contact with the fungus that has left the infected person or is present. Well, if this is the hand of an infected person and he shook hands, if it's shared footwear or items that were used by the infected person. I'm not even talking about slippers or benches, but it could be a shared towel or a floor that hasn't been properly cleaned somewhere in a bathhouse, sauna, swimming pool, and so on. It can often be from a manicure as well. So, the places where onychomycosis is most commonly picked up, in quotes, are gyms, bathhouses, swimming pools, and of course within the family, where one person can infect everyone else. The factors that contribute to the development of onychomycosis are micro-injuries to the skin. Well, since the skin on the feet gets damaged much more often due to friction from shoes, sweating, the inability to keep the area dry or maintain dryness, and the inability to promptly eliminate moisture, like, for example, to change your shoes, right? All sorts of chafing can occur because of shoes. That's how it is. In other words, it's really possible. Another set of factors that contribute to the development of onychomycosis are certain pre-existing conditions you may have. First and foremost, these are any diseases that disrupt microcirculation. That is, fungi will thrive and find it easy to multiply if there is a lack of blood flow in the area. When does this happen? When there is any form of diabetes, obesity, hypothyroidism, that is decreased thyroid function, any vascular diseases, both arterial, for example, obliterating endarteritis or obliterating atherosclerosis, as well as varicose veins, venous insufficiency, any immune disorders, and HIV infection, which is a whole separate topic. Onychomycosis in HIV-infected individuals. Taking certain medications, particularly those that suppress the immune system, such as steroids or cytostatics. The use of antibiotics is also significant. Older age, as I mentioned earlier, increases the likelihood of onychomycosis. But this, by the way, happens not only because elderly people have poorer blood circulation in the feet, but also because proper hygienic care is often impossible. Simply due to age, a person may not be able to wash their feet properly. They just can't bend down and trim their nails well. By the way, it is largely due to hygienic factors that onychomycosis is 10 times more common on the feet than on the hands. First of all, hands rarely come into contact with clothing that rubs against them. This is one. Secondly, hands are washed and disinfected much more frequently. Thirdly, it's unlikely that due to clumsiness, we would be unable to get rid of excess moisture on our hands for a long time. After all, you can always dry your hands. Again, trimming fingernails is much easier than toenails, and so on and so forth. Theoretically speaking, when it comes to onychomycosis, 3 types of fungi are identified or detected. At the same time, the most common fungi, which account for almost 90% or even more of all cases of onychomycosis, are fungi called dermatophytes. There are also various non-dermatophyte mold fungi, which make up about 10% of cases. And then there are the famous Candida fungi. They can also on occasion cause onychomycosis, but that is an extremely rare occurrence. The symptoms, by and large, are basically obvious. Nevertheless, I have to mention them because they are very diverse. First of all, there is a change in the color of the nails. The nail plate becomes yellow, green, brown, or sometimes black. All shades of these mentioned colors can occur. In addition, the nail plate may separate from the nail bed, thicken, or conversely soften and become thinner. Sometimes the nail becomes concave, resembling a little spoon. Deformation is possible, such as various pits, ridges, and grooves. All of this appears on the surface. There may also be thickening and inflammation of the tissues around the nail, and based on the symptoms, almost always, at least a doctor can say, yes, this is a nail fungus. But based on the symptoms, it's practically impossible to say, for example, that this is dermatophytes, and that is non-dermatophytes, or specifically Candida or something else. So, it's important to understand that while you can diagnose onychomycosis to determine exactly which fungus it is, further testing is necessary. What is important to know? And now, this is a very important factor that explains a lot. Look, as a rule, a fungal colony infects the nail plate, and the colony itself grows toward the matrix, that is the base of the nail, while the nail is also growing. And here, this is where it matters who is faster. That is, the rate at which the nail grows can be much faster than the rate at which the colony grows, and in that case, the fungi will not take hold. So the slower the nail grows, the higher the likelihood that this disease will develop and progress severely. That is precisely why children almost never get it. That is also why any condition that disrupts blood circulation, that is, affects the rate of nail growth, increases. A, the likelihood of onychomycosis, and B, the likelihood that it will be a severe form with very serious deep damage. Accordingly, it's clear it's more common in the elderly, in people with circulatory disorders, in people with obesity, in those who wear tight shoes that impede blood flow. It's more common in all these groups, and so on. Onychomycosis is especially dangerous. By and large, it's an inconvenience. Of course, no one dies from it, but it's a problem that can lead to very serious complications, especially in diabetes. There's even a term, diabetic foot, which refers to severely impaired blood circulation, and onychomycosis contributes to the development of what's called diabetic foot. Now, regarding diagnosis, of course, the doctor can usually tell at a glance that it's onychomycosis, but as a rule, it's customary to confirm the diagnosis. So how is this confirmation done? First of all, the nail plate is wiped with 70% alcohol. I'm just trying to explain this to you so you understand what the doctor is doing when you come in and show them your unfortunate finger. So first they wipe it with 70% alcohol to kill bacteria. This won't affect the fungi. Then they take a scraping. The scraping can be taken with a blade, a scalpel, or they might snip off a piece with scissors. Sometimes they even use a dental drill directly. Then the material they've taken from you, this scraping, is placed into an alkaline solution. This alkaline solution dissolves the keratin, and then the sample is dipped into ink, which highlights the structures. Well, the fungal filaments will be visible. After that, they look at it under a microscope. As a rule, the fungal filaments are clearly visible. In fact, if the doctor needs to clarify which fungus it is, if there are any doubts, uncertainties, or if previous treatment was ineffective, what options are there? The first option is culturing. A special medium is used, but the fungus can take up to 3 weeks to grow. And there's about a 50% chance that nothing will grow. Now there is already a separate diagnostic method using PCR. This method determines the presence very quickly, but it's quite expensive as it detects the DNA of the fungus. And you can say for sure, yes, that's it, that's the culprit. And this is already widely used in modern clinics and laboratories. Now guys, let's talk about treatment. That's actually what everyone expects from us. But it's not that simple. So first of all, treatment can be either local or systemic. That is, with local treatment we apply something to the affected nail, and with systemic treatment we take pills. What is the advantage of local treatment? The main and only advantage of local treatment is that it does not have the side effects of antifungal medications that need to be taken orally. But I want to point out that the effectiveness of local treatment, to put it mildly, leaves much to be desired. And in general, local treatment is typically only effective when only the surface of the nail plate is affected. That is, just the very surface. And when we see a doctor early, which, as you might expect, almost never actually happens in real life. So in general, I would draw the following conclusion. When you do eventually come to a doctor with nail problems, such as a fungal infection, we almost never encounter a situation where the condition can be treated exclusively with ointments, special medicated lacquers, or similar topical remedies, and so on. Almost always, I repeat, with a probability of more than 95%, you will need systemic therapy as well, and as a rule, a combination of these two methods is used. The advantage of topical treatment, on the one hand, is that it creates a very high concentration of the antifungal agent in the areas where the topical medication is applied, but it does not penetrate deeply. Therefore, I repeat, in cases of deep infection, it does not work. Now, what actually precedes topical treatment, regardless of whether it is used alone or in combination with tablets? First of all, you need to remove as much of the affected part of the nail as possible. This involves using files, clippers, and dental drills. Special keratolytic plasters are also used. These are plasters that contain urea plus salicylic acid. In some cases, when there is total nail involvement, surgical removal is performed under anesthesia. There are medications for topical use in the form of lacquers, as well as creams and ointments. Everyone really wants to use lacquer, and it looks very appealing. Nevertheless, numerous studies have shown that lacquer is actually even less effective at helping antifungal agents penetrate deeply. That is, while ointments and solutions at least somewhat allow the medication to penetrate the surrounding tissues locally, lacquer practically not at all. So, lacquer still remains a very attractive, appealing, and in quotes, commercially very effective remedy. But still, whenever there is an opportunity to use ointments and creams, it is better to use ointments and creams. Now moving on. Look guys, I completely understand, and it is a huge, tremendous pity that many of you, after listening to this message of mine, will try to treat yourselves. I do not want you to treat yourselves. I want you to go to a proper specialist who can help you. But I admit that you may be somewhere where specialists are simply unavailable, or there just aren't any at all. So you will have to make decisions on your own. But when making decisions independently, you must avoid doing anything foolish. In fact, that's exactly what I am urging you to do. My friends, I fully understand that everything I've just said will basically help you arrive at the diagnosis of nail fungus. And now I have to say the following. Quick march to the doctor. But I fully understand that you might be far from medical care, or far from doctors, or far from doctors who are familiar with modern treatment methods, who might just send you to the pharmacy to buy some ointment, and you could end up applying that ointment for a long time without any results, or using some expensive lacquer, but again to no avail. So once again, I want to draw your attention to this. I will give you the simplest instructions, but I still want you to clearly understand that you should only resort to these instructions if you have absolutely no way to see a proper doctor. All right? Please and thank you. So, let's start with the medications that are used for local treatment. Remember, and I want to emphasize this again, local treatment by itself almost never works. We'll talk about systemic treatment later. So there are several medications. I'll name the most common, relatively inexpensive, and most effective medication for this condition. It's called naftifine, which is widely recognized and frequently prescribed by healthcare professionals. Here it is, these words right here, naftifine. Now you can type the word naftifine into Google, and you'll get a huge list of what's available in pharmacies near you. In addition, there is a medication called cyclopyrox. Right away, you can also search for this name in the same way. I'd like to point out that as a rule, doctors in Europe more often use naftifine, while in the USA, cyclopyrox is the most commonly used. Besides these, there are two more medications. They are called amorolfine and efinaconazole. Here are those names for you. That's all. Now, as for the duration of topical treatment, it is almost never less than 3 to 6 months and can last up to a year. Now, about systemic treatment. Once again, and I repeat this many times because it's important, we need to combine topical and systemic treatment. Of course, this is much more effective because the blood will deliver the active substance to all tissues, to every tissue, and this will really work. The most effective medication, which is recommended in the majority of guidelines, is a drug called terbinafine. Its most famous brand name is Lamisil. So this is the #1 drug. There are also the drugs itraconazole and fluconazole. For example, fluconazole is not approved by the American FDA. But for instance, even British doctors strongly recommend it. It is important to note that the main drug, terbinafine, only works against dermatophytes, and it has serious contraindications in cases of acute and chronic liver diseases, whereas itraconazole, for example, is effective against almost everything. In any case, this is exactly why I would like you not to make decisions on your own. I would also like to point out that fluconazole, the one not recommended by the American FDA, is usually prescribed when no other options are available for a patient. It's essentially the only possible medication in such cases. Sometimes so-called combination therapy is also used. The standard regimen is 1 tablet. Each tablet usually contains 250 milligrams of terbinafine, and it is taken once a day for at least 6 weeks when treating the hands, and for at least 3 months when it comes to toenails. Although in reality, 3 months is almost never enough for toenails. Typically, 6 months is just right.